Dear friends, I am Dr. Deepak Chaudhary, Principal Director and Head Department of Arthroscopy and Sports Medicine at BLK Max Super Speciality Hospital, New Delhi. Today I will be speaking on meniscal root repair. The meniscal tears recently have gained a lot of importance in view of their important functional role, and it is considered that a meniscal root repair is equivalent to a total meniscectomy, resulting in lot of increase in contact forces at the knee joint. So in view of that, the treatment of meniscal root tear is quite important. Why do we repair the meniscus? Because a meniscus has very important role. It helps in load transmission, it minimizes the contact stresses, it contributes to stability, and it is chondroprotective. So for all these reasons, the meniscus must be repaired whenever possible. And what are the effects of a meniscectomy? If you do a partial meniscectomy, that results in a 65% increase in load, and if you do a complete meniscectomy, that results in a 235% increase in local contact stresses, resulting in osteoarthritis of the knee. So what are the considerations that you must consider while doing a meniscal repair? The most important is the location of the tear. The better the tear is in the vascular zone, the outer red zone, the better are the chances of healing. The configuration of the tear, again longitudinal tears, bucket handle tears, they are most amenable to repair. Length of the tear, the shorter the length, the better is the chances of healing. Again, stability of the joint, whether the tear is acute and what is the age of the patient, they all help in predicting that the success rate in meniscal repair. So what are the principles of repair? Whatever method you choose, the principles remain the same, and the ABC of meniscal repair is the anatomical reduction, biological preparation, and circumferential compression. Pike resting is a very important technique by which in a tight knee we can easily approach the posterior horn of medial meniscus, in which a needle is taken and gradually the MCL is lengthened under control. So this allows you to reach the posterior horn comfortably without damaging the articular cartilage. So pike resting helps in treatment of meniscal repair, especially in a tight medial compartment. Again, if you are doing an isolated meniscal repair, one must do a bone marrow stimulation so that growth factors, they come out and help in the meniscus healing. If you are doing a concomitant ACL reconstruction, this step is not required. So we present a case of a root repair in which a 28-year-old male presented to us with a twisting injury of the right knee. He complained of pain, limping, swelling of the knee. His Latchman test was positive, his medial joint tenderness was there, the McMurray's test was positive, the collaterals and the PCL was intact. The MRI finding confirmed an ACL tear as well as a root tear. And this is the surgical video of the patient, and you can see that this is the posterior horn of medial meniscus, and it has been lifted up from the posterior horn where it is attached to the bone. So this is the root tear. So before repairing it, we clean the area, we prepare the bony bed where the meniscus has to be fixed with a combination of shaver, curate. The bony bed is prepared so that there is a bleeding surface which permits bone healing. Next, with a scorpion instrument, we take a bite with a fiber tape through the meniscus in a stinged fashion, and this makes our construct very robust, and loop is retrieved and a loop is created. Now we make a small tunnel 6 millimeter diameter on the bed of the where the meniscus has to be fixed, and through this tunnel we pass fiber wire which is retrieved out through the medial portal, and then the two sutures which have been placed in the posterior horn of medial meniscus, they are railroaded through this tunnel and as you can see now the meniscus is back into its position, and this is fixed by a bioabsorbable screw and again supplemented by a swivel lock, resulting in a very robust repair. So in conclusion, one must save as much meniscus as possible. Remember the ABC of meniscal repair, that is the anatomical reduction, biological preparation, circumferential compression. And this is a patient who underwent the ACL and the meniscal root repair, 1 year follow-up, and patient is a professional Bhangra dancer and quite satisfied. And thank you very much for your kind attention.